Welcome to Green Time. I'm host Don Fitz. This episode, we're going to be discussing broken healthcare, its effects on patients and families. And with me, I have a couple of guests who have worked a lot in this area and thought a lot about it. I have Mimi Signor, who is a registered nurse with Missourians for Single Payer, and I have Dr. Pamella Gronemeyer, who is a physician and has a small business. I want to thank both of you for participating in the discussion.
Thank you.
This episode. Thanks. And does healthcare in the U.S. cost more than in other countries, and why would it cost more?
It's 18% of our gross national product,
and it's not. Higher?
Oh, that's very high. Yes, that's very high. I mean, we're up to like $8,000 a person, and I mean we're like twice what most countries are.
Mm-hmm. Our healthcare is the most expensive, and only a fraction of us can even access it.
And we don't live longer than the other countries that are spending less.
Yeah, that is amazing. I think that in Europe, people frequently, the United States life expectancy is 78 or 79, and in Europe it's usually like 80. Most countries it's like 82 or 83. I think Cuba spends something like less than 10% per capita on healthcare of the U.S., and their life expectancy is like 6 months shorter than the U.S. or 3 months shorter than the U.S. And so it's...
But for many people, Medicare is the best insurance they ever have. That's why they're happy to get on Medicare, because once they become 65, they have good health insurance.
Okay. Could you tell me about healthcare rationing? Does that really happen in the United States? Do people really get healthcare? I mean, physicians have told me that if you need healthcare, you get healthcare despite what the system is. Is that the case, or is healthcare rationed according to insurance
I've heard that many times. I've also heard we have universal healthcare because anybody can go to the emergency department, but the emergency department is not good for anything but emergencies. If you go to any hospital, they'll say, our emergency department has to treat you.
It's a law.
But they don't have to treat you in a very timely way. You may sit in the waiting room for many hours. It's called triaging. Certainly if you're in an accident and your guts are spilling out all over the table, they're going to take you first. But if there's any doubt whether you have anything as serious as that, you may wait a very long time in triage. But basically, I mean, we in healthcare call it treat 'em and street 'em. So they don't have to really do anything except stabilize in the emergency department, and they don't really have to give you anything to like take home with you.
Well, they're acute care. I mean, they're not going to worry about the fact that before you got hit by the car, you're hypertensive, your blood pressure is going off the roof. They I mean, that's not what they're set up for. They're set up to handle acute care.
And they're not going to give you a prescription for medicine to go home with you. You know, you're just
in emergency care, you're probably not going to get the prescription to go home?
No. No. You have to follow up with somebody and then get your...
Well, sometimes you get a prescription for your antibiotic, but you don't get the antibiotic, and if you don't have the money to fill the antibiotic, you go home without the antibiotic, then you come in... I mean, I've seen this happen. Somebody was bitten by a dog in one of the smaller hospitals in Illinois. Well, he wasn't bitten by the hospital by the dog, but he came in after a dog bite, and they sent him home with the prescription for an antibiotic, and he didn't get it filled. So the next week, when he came in, he was in disseminated intravascular coagulation, and they sent him to another hospital, but he didn't make it.
Oh, he didn't make it?
No, oh no.
So he died as a result of not
getting the prescription filled.
Not getting the prescription filled. So an emergency room treatment system is really not a very good way to deal with the issue.
It's definitely not universal health care. I don't care what anybody else says. They have to treat you. But it doesn't mean, they're going to do anything else but stabilize.
Well, they won't anyway, because when you come in, you're in an acute situation, so they're not going to handle your cholesterol or your blood pressure, because a lot of that's affected by the state.
Well, and some people aren't. I mean, if you need a throat culture, say, for example, you have a really bad sore throat, you go to the emergency room because you don't have insurance, you don't have money, they have to do something. But I mean, I don't call that universal health care, and that's our safety net.
Well, let me ask you this. We are told that everybody's supposed to have health insurance with the Affordable Care Act. Are there people who still can't get health insurance, or people who have health insurance and lose it? Does that happen?
When you didn't expand, I mean, the ACA was built on the fact that you included Medicaid expansion for all the states. And there were states that didn't expand Medicaid, so therefore the people that are single people without children, they're still not eligible in those states for Medicaid. And I'm not saying that Medicaid, I think, is not as good as other health care, just because it's hard to find a doctor. And I mean, the doctors that pay reimbursements so bad that doctors can refuse it. So I mean, so in states so there are people that are still left uninsured because they can't get the Medicaid expansion, and there are still people that won't buy.
I'm not sure what the numbers are, but it's almost like half the states did not accept the federal dollars to expand their Medicaid. But really, it was just that on principle they didn't want to do it, because we don't want to help poor people get health care. It's very, very cruel and hard-hearted, but that's the way these legislatures are in those states.
There are people who still are not insured. What about people losing their insurance? Does that happen?
It happens a lot, and it just recently happened with United Healthcare. United Healthcare had contracts with I think it was an ACA plan, and they recently said, well, it's not profitable, so we're getting out of it. And so the people who had that health insurance, now they're not insured. They have to find something else.
So if the plan disappears, you don't have health care.
It disappeared.
You have to find something else.
With insurance companies, they get to make the rules and they get to change the rules. They can stop and start. They can change their drug formulary. They can do anything they want at any time. You, however, have to enroll in the enrollment period, and you're stuck for the rest of the year.
Well, and they can't deny you by pre-existing conditions, but that doesn't mean they can't charge you more if you get older. I mean, because everybody who's getting old, I mean, that's with my employees. I have good employees. They work for me for a long time. We don't have much turnover. So, I mean, they become, to the insurance companies, they're more expensive. I mean, they're more expensive for me.
So the insurance, you have to be able to get insurance even if you have a pre-existing condition, but that doesn't necessarily mean that you can have affordable insurance. Right. And you can end up paying so much that you don't want to pay.
You can't afford it.
Don't want to pay. Okay.
For small businesses,
we're going to take a break.
Oh, sorry.
And we will be right back in just a minute after seeing a couple of clips from Fix It.
My father, late in his life, was an over-the-road truck driver. He had some modest success and kind of went from one truck that he drove himself, buying a second and third truck, and ultimately having a couple of employees that drove for him. He had achieved, in some very modest and small way, late in his life, the success that I think he always had dreamed of. Unfortunately, he suffered a kind of catastrophic truck accident where his truck actually flipped over a guardrail and landed on the highway beneath him. I will never forget being there when he woke up in the ICU, and his immediate reaction was to try to rip the lines out of him and get out of there. And I said, Dad, it's okay, you're in the hospital and you're in the ICU, it's gonna be all right. And he said to me, no, you don't understand. He said, I can't afford this. I gotta get out of here. And it bankrupted his company. So the two folks he had working for him didn't have a job anymore. Doing all the right things, playing by the rules, working hard was all eliminated like that with one accident.
And what about single-payer health insurance? What does it mean? One entity that pays the bills. We get rid of the hundreds of complicated insurance plans, and we have one comprehensive plan that covers everybody. It's simple and efficient. You go to any doctor or any hospital you want, present a card, and you're covered. There are no deductibles, no out-of-pocket expenses, and no contentious pre-approval before treatment. Everybody is covered. Nobody is left out. Single payer is not a government takeover of healthcare. The doctors and hospitals remain totally independent, just like they are with Medicare.
If I told you that every one of your employees could get the health care they need guaranteed, that your costs would go down, everyone would pay less and get more, you might be skeptical. But the truth is, most every country in the world does that.
The benefits in Taiwan's single-payer system are comprehensive. You have inpatient care, hospitalizations, visits to doctors, drugs, dental care, pre-child delivery, dialysis, all of that is paid for. Patients have complete freedom of choice of providers. Taiwan spends 1.6% of its total operating budget on administration. And that is a tiny fraction of what we spend in this country. It's the peace of mind that it gives people, which Americans don't have yet. I hope every American has that someday.
Our current broken healthcare system is the most rationed healthcare system in the world. That's why a third of Americans don't get the healthcare they need.
The idea that you can have high deductible policies and that you're not rationing healthcare by income class, I would say, where were you educated? That isn't even requiring a PhD, that's just common sense. Think of a waitress making $30,000 and you ask her to cough up $10,000 out of pocket.
One of the biggest differences between the United States and the rest of the world, studies by the Commonwealth Fund and others find Americans are much, much more likely than people in other countries to defer medical care because of cost.
Welcome back to Green Time. I'm host Don Fitz. We are discussing broken health care, how it affects patients and families. And with me, I have a couple of guests from the healthcare field. I have Dr. Pamella Gronemeyer, who is a physician and has a small business. And I have Mimi Signor, who is a registered nurse and with Missourians for single payer. Now, let me ask you this. Right now, healthcare is not viewed by the legal system as a right. Should we talk about making healthcare a civil right? Should we talk about making healthcare a human right? How should healthcare fit into the whole way that the American society views taking care of people?
It's not viewed as a human right by the people, not necessarily even the legal system. I mean, because that's what the issue was in Vermont before they tried to push their single payer system. They had a whole campaign to try to make people realize that healthcare is a human right, because anybody can get sick, and we know that. I mean, we know the nicest people who do everything right can get a terrible disease and need healthcare.
Absolutely.
I mean, so there's no, if you're good, you get rewarded, and if you're bad, you get punished. That's not the way it works. But I think that partially the way that so many people now believe that you have to earn it, that you have to earn health care. But, how can a baby earn health care? I mean, why should a baby be punished because their parents have fallen on bad times and they don't have jobs? I mean, to me, it would be a much stronger country. I mean, we want to send our young men out to be in the Army. Shouldn't we be taking care of them to make them as healthy as possible all the way through their life?
Well, let me ask you this. Do you think it would be more important for most people to have a right to keep and bear arms or the right to get health care?
Well, you know that I have to believe that healthcare, the right to bear arms, I think was written at a time when we didn't have a military and we didn't have a police force. But I think that obviously healthcare is a human right. It's just, it's very naive to believe that if we ever were to have an epidemic in this country, if we didn't have healthcare for all, you wouldn't be able to bottle yourself up or live in a bubble and prevent yourself. It's just smart to have a country where we work to try to keep people healthy, and we can do it.
Right. And it is, I was saying that Not necessarily facetiously, because the Constitution also says that we have the right to petition to redress grievances. We have the right to organize for peaceable demonstrations, and it is amazing that that healthcare is not seen as at least as basic as political rights, which were guaranteed.
But it was written in a different time.
Yep.
I mean, we're talking about in the 1700s. I mean, there probably was. I mean, they didn't even have the germ theory then. So,
if we're entitled to a public education, it makes sense. We should educate all of our children, not just some of our children. It also makes sense that all of our children deserve to be healthy, not just children who are born, who are lucky enough to be born with a silver spoon. It's just cruel, and I think that it's a lack of empathy on our society, that we don't care enough to do this. Why don't we? Why do we have to say, I have mine, so it's not my problem if you don't?
Do you think it's really an issue that the majority of the society doesn't care, or is it the majority of the people with power who don't care?
I think it's apathy, because you have to care enough to do something about it. I mean, it's supposed to be a democracy, so the people we elect are supposed to do what we tell them to do. Well, they're doing what lobbyists tell them to do, but they're not doing what we want them to do. But maybe we're apathetic and we're not telling them what to do.
But they've also been told that if you have a health plan that's with that you pay through your taxes, the government's going to get between you and your health care. Which is not true. Medicare does not get between you and your health care. Medicare, I mean, basically, Medicare, I mean, when I write, just even for a physician, it costs every physician between $70,000 and $80,000 to have somebody do their billing. So that's extra cost, because we have to write different claims for each insurance company. We have to call the insurance companies. They don't just pay when you send a bill in. They will fight you, hook, line, and sinker. Medicare, if you write a clean claim, you're paid, and it's on a published fee schedule.
So it's a lot of wasted time.
Wasted. I mean, employees. I mean, wasted time. They could do something that was better.
Now, one of the things that I know that you told me to ask about was Medicare Plan C.
That was Pam's question, I think.
Okay. Now, why is Medicare Plan C an issue?
Well, Medicare Plan C came up during the Bush administration, and it was an effort to privatize Medicare. Basically, what happens is, the theory is that if you let the insurance companies manage Medicare patients, they'll do a better job and they'll have better outcomes in managing the health of their patients, of the enrollees. So what happens is, they're paid an increased percentage over conventional Medicare of probably 11% more than conventional Medicare to manage it. But realistically, I mean, what they do is they enroll the people, but they also have narrow networks. So you have primary care who has to refer you to your specialists. And what they did in many of them, they went through like St. Louis, I believe, they eliminated 200 specialists out of their network.
Oh, wow.
So it makes it, I mean, it takes you longer to see the specialist. Now, what the theory is, if you really need to see them, you'll wait. But is that, I mean, that's just adding.
Well, your condition could be getting
Many
worse.
Many hospitals don't accept that. The Medicare C, it's called Advantage. Many hospitals won't even accept that as an insurer, and many physicians won't either, because the reimbursement is smaller.
Okay, so it's
that's why their networks are so small. But it's perhaps the hospitals and physicians who need the business that will accept that insurance.
One thing that we should mention is that there's a belief that everybody now has insurance, maybe not medical care, but insurance. But are there people who don't have insurance because they can't afford it, choose to pay a fine instead? And also, have you seen people who don't use their insurance because the copay is so high?
There are a lot of people that are underinsured.
Probably more people who have it and can't use it because they could never afford the out-of-pocket expenses. Really, they ration their own health care that way.
They're almost using it like catastrophic insurance. They're almost using it like if they only use it, if they absolutely have to use it. And I mean, with the theory of prevention, I mean, that defeats the whole theory of prevention.
Preventive medicine
I mean,
is out the window.
because they're not using it. I mean, and it's just, we know that was the problem with underinsurance, because now in the Obamacare was sick with the bronze, silver, and gold. It's 60, 70, and 80% of what you pay for the gold. They pay for 80%. But the old health insurance we used to get from our employers was 85%. So all of them are less than what we used to get. But I mean, many employers also wanted to get out of the burden of health insurance.
Yeah, I can understand that. Okay, we're going to take another break. We're going to see another clip from Fix It, and we will be back in just a few minutes.
I am Dan Conkin, and I'm the president of Amco Manufacturers. We're a family-owned business and been in business for over 47 years. I'm a member of the Conservative Party of Canada, and we stand for removing waste, being more efficient, and finding ways to grow our own businesses. And one of the greatest ways that we can grow our business is to reduce cost. And that's why we embrace the Canadian healthcare system. What I don't understand is why my fellow conservatives in the United States tend to fight this.
So my name is Terry Alexander, and I work for Amco Manufacturers, and I've been an employee here for 17 years. From what I've experienced, the Canadian healthcare system is amazing. I've felt very well taken care of. I didn't feel like there was any treatment that was available that they weren't providing for me. My appointments were very quick. While I was going through my treatment of my surgery and the chemotherapy and the radiation therapy, it was absolutely exhausting and very stressful and lots of anxiety. If I had had the added burden of coming up with thousands of dollars for my health care coverage to fight this disease, it would have been devastating. It would have been horrible. When I hear that people say our Canadian system isn't good, it makes me a bit angry because I'm quite proud of our Canadian system.
Welcome back to Green Time. I'm host Don Fitz. We are talking about broken healthcare patients and families. Mimi Signor, tell me, what is some of the information that you think was left that we should be covering in addition to what we covered before?
The recent Gallup poll, 1 out of 3 Americans polled said that health care was their biggest financial burden, and it was the number one problem being listed of all the financial burdens. And I think that's very significant. And that's for people who have the burden. It's not for people who are going to have the burden. I think that, we are just a catastrophe away from bankruptcy. And it doesn't matter if you have health insurance or don't have health insurance. The out-of-pocket costs are so high that I think you could lose everything in an instant: a car accident, a heart attack, any cancer diagnosis, and really you could lose everything.
Dr. Gronemeyer, what would you like to leave the viewer with concerning the biggest issues of healthcare?
Well, I would like to leave with the fact that I believe if they explored and learned about single payer, they wouldn't be so afraid of it, and they would know that it really is the best way to go. And there are many conservatives who agree, and it's not just liberals, it's also conservatives who agree that this probably single payer is the only way we're really going to control healthcare costs. So I think that people need to learn about it, and I don't think it's pie in the sky. I think other countries can do it. I mean, Canada's done it. We can do it. We just have to really believe that it can work and that we really need to try it.
Dr. Gronemeyer, Mimi Signor, I want to thank both of you for participating in the discussion. I want to thank all of our viewers for tuning in and for thinking about this, and I hope that everybody looks at Green Time the same time next week.